Okay, for those of you that can't get to school, I want to make sure that you see the procedure for doing a urinary catheter. There's some other things that I will send you. One is just a very brief overview of some of the some catheter facts. I think it's like 10 slides, but I'll make sure that you get that as well, because that's something that they saw. There are a couple of videos. I'll also give you the links to that, but nothing long. This is going to take not more than 30 minutes. I know that you guys won't have the chance to practice until you get back to school, but hopefully this will give you an idea of sort of what you need to do. Let me explain some of the things that I've got here. Catheter kits will come in a plastic bag, and then inside of the kit there'll be a package that looks something like this. It's folded, and the it's folded so that you can open it in a sterile way. It's important in sterile technique not to reach over a sterile field. It's important that it should be your sterile field should be at least waist high, that you don't drop your hands below your waist, and that you can touch sterile to sterile, but you can't take sterile to non-sterile because you'll contaminate that one hand. Can't think of anything else as far as the sterility piece goes. If I do, then I will mention it as we go through the process. All right, so once we've got the this package out of this bag, I'm going to use this as kind of a little garbage can to hold anything that might be that I might need to discard of during the procedure. So what I've done is I've just kind of folded it over. It's not going to stand up very well, but you can kind of put it over to the side, kind of lay it like this, and it will be there if you need to throw something out. The big thing with throwing anything out is that you will have on sterile gloves, and you want to make sure that when you do throw something out that you don't touch with your sterile hand or your sterile gloves that bag. So you're going to kind of throw it into the bag rather than put it into the bag. All right, when opening this catheter box, you'll notice that there is, I'm going to show it to you because it's hard to see it on film, but you're going to open the side away from you first, all right? And then the two sides will open up. And then you will take the last little piece here and open it up towards you. The reason that you do it that way is because you don't want to reach over the sterile field, because as soon as you reach over that sterile field is no longer sterile, and you'll have to start over again. I'm kind of turning my my area a little bit with my fingers. You can touch about an inch of the outside of the sterile field with your bare fingers. That's considered not sterile. So that's perfectly okay, especially if you want to move things around. Now we're actually ready to start the procedure. One thing that we're going to do as far as the checkoff goes, and I would encourage you to go and look at the checkoff sheet that's been provided for you. And maybe watch this video more than once, just watch it with me doing it and then look at the checkoff sheet as well. I don't have the checkoff sheet in front of me, but I'm going to pretty much follow along. And then if you have any specific questions, please feel free to email me. We're going to want to do pericare. So when we do pericare, we're going to suds up water and soap. And when we do this, of course, I'm going to have on gloves, all right? In fact, let me put them on. So there won't be any doubt in your mind as to what is being done. So I've washed my hands. I'm putting on my gloves. And these are not sterile gloves. These are just regular clean gloves. And then I'm going to take my washcloth with soap. I'm going to go down the side furthest away from me, all right? I'm going to change places on my washcloth, go down the side closest to me, change the side of my washcloth again, and then straight down the middle. I'm going to make sure that I rinse it and then pat it dry. And then we kind of have a clean slate to work with, so to speak. All right, so now that I have got my patient cleaned with the Pericare, I'm going to remove my gloves. Please note that I'm holding my gloves like this, wadding them up in my hand, and removing the other glove, and then we can dispose of it. All right, so back to my little kit. I'm going to move it so that you can see it and just tip it a little bit. What we have on the top is the first drape, and that's what actually is going to go underneath the patient or below where we're going to be working, and then I'll go from there. But I kind of wanted to give you just a little overview of what's in the box, and I'll probably do that again just so that you can see it. You wouldn't do this if you were really wearing sterile gloves because you would break sterility, but just for the purpose of this video, I want you to be able to see it. So, so I'm going to move this back down here just a smidgen, and I'm going to take, with my bare hands, I'm going to take off that first drape that we're going to put underneath the patient. So remember, there is a 1-inch border, and you can see here's the drape, and there's actually, and it's going to be harder for you to see on the video, all right, but there's actually a shiny side and a dull side. This is the shiny side, and you can almost see it in the video a little bit, but it's shiny. It's like plastic kind of feeling. But you are going to put this underneath your patient, and when you do this, and this is going to be easier to see in person, okay? So the whole idea is that you don't want to cross your arm over that sterile field. All right, so I've got this under my patient. I've only touched the outside border, the outside 1-inch border. There's another piece in here, and I put this in here just so you all could see it. But this is what they call the fenestrated drape, and they do mention this on your checkoff sheet. At one point, Southeastern, not Southeastern, but Cape Fear was using these. They are no longer using them. The whole idea was to just make sure that the area stayed sterile and that you didn't touch anything. But the problem is, especially with a female, you almost have more trouble keeping your gloves sterile than you do if you just didn't use it at all. I don't think they use them at Southeastern. They don't use them at Cape Fear anymore. So we're just going to take that and get rid of it. Okay, now at this point, I'm going to put on my sterile gloves. Now, I want you to pretend that none of this exists, because I'm going to move this to the side just momentarily. And for the purpose of the video, I'm just going to pretend that this is a different surface so I can show you how to put on your sterile gloves. Now, these two thumbs are evil. I want you to raise your two thumbs and say evil thumbs, because these thumbs will get you into trouble when you are trying to maintain sterility when you're putting on your sterile gloves. So here are my sterile gloves. If you'll see, probably not real good, but there are two hands. One is labeled left, one is labeled right. So we don't even have to think about which glove goes onto which hand, which is kind of handy when you're checking off and you're really, really nervous. So at this point, I'm going to open my sterile gloves. Again, this is not a sterile field at this time. All right. I'm just doing this for the video so you guys can see it, and I don't have to move my phone around a whole lot. So now I've got my gloves open. Again, there's a 1-inch border around the packaging, just like there would be in any other sterile field. So I'm going to put my right hand on first, because my right hand is dominant, and I want to be able to manipulate. I'll be able to manipulate with my right hand better than my left. Now, when you open the gloves, you'll see that there is a cuff, all right? The inside of the glove is considered non-sterile, so I can touch it with this hand right here. I have to take my other hand and put it in to this glove, and once I get it in, I'm good to go, all right? Now, here's where the thumb has to stay in. You tuck it in, you keep it in, because what is happening is, and I'm going to try to show this to you, you're taking your fingers, and you're going up inside the other cuff, all right? And what students have the tendency to do is go like that. And when they've done that, they've actually contaminated the glove. So we want to keep the thumb tucked up in under that cuff. And then I'm going to put my glove on, and I'm going to kind of, I'm going to go like this and make it look funny, because I want you to see here that if you put your gloves on and you don't get your fingers in the exact right place, now you've got a sterile hand which can touch a sterile glove, and you can just manipulate them until you get them all into the right place. And I've actually turned the darn thing inside out. There we go. And now you're good. Okay, so don't watch this part, because I'm going to bring everything back to where I wanted it. Okay, so now we're back to the kit. I'm going to just tip the kit now so that you can see it a little bit. What we have in the kit right here is your iodine swabs. This is a syringe filled with sterile water. All right, that is going to go into the the little balloon at the tip of the catheter, and I'll show you that in a second. And then this is actually a syringe filled with lubricant, and this will be put onto the tip of the catheter to facilitate that catheter moving into your patient. Okay, so at this point, what I want to do is I want to make sure I've got everything in order. See, I can manipulate my little drape here because I'm sterile. That's sterile. All right, so I'm going to take this little tray out. This will probably be a little easier for you maybe to see. And I'm going to prepare, and I'm going to open everything up so you guys can see it at home, because you don't have the advantage of being right here with me. So the first thing I'm going to do is, these are actually iodine swabs. They look like really giant cotton swabs. But I'm going to open this up. It's going to be messy. And if you're ever practicing with this in the lab, which I wish you wouldn't, but if you ever open them up, make sure that you don't touch them to the mannequins, because they will stain the mannequins. All right, and I'm just going to keep them like that. You can see I kind of pulled them out. Keep them like that so they're ready for me to use when I want to use them. This is the lubricant, and all you're going to do is there's a little cap that comes off the top of the syringe, and I'm just going to take that and I can toss it into my my bag. All right, which was not very graceful, but nevertheless, this lubricant, I'm going to squirt it right out into the tray. All right, so that it's ready for my catheter tip when I'm ready to put it in there. And then I can just discard this over to the side. All right. All right, now I'm ready to take my catheter out of the box. And this thing really wiggles a lot, so you have to kind of make sure that as you're taking it out, that you're maybe like winding it around your finger so that it doesn't flop everywhere. Okay, once you've got the little blue or clear lining off from the catheter, which you can see right here, I'm going to put it over to the side. And at this point, I am going to take the end of this catheter and put it into my lubricant, which I have put into this tray. Now, so you kind of have to manipulate it sometimes so that it won't go everywhere. All right, the next part is I want to have this attached. This syringe contains the sterile water. All right, so I want to have this attached to my catheter. All right, so there's probably about, it looks like about 8.5 milliliters of sterile water in here. It's just good to take note of that. Over here on the catheter, you'll see that there is it looks like this. All right, you're going to take this little side thing and you're going to connect that syringe with the sterile water into that little port on the catheter. And then you can just lay the whole thing down, because now it's time to get ready to do the actual catheterization. So this is my left hand because I'm right-handed. I am now going to place on the patient, and once I put this hand on the patient, we are not going to let go, because now this hand is contaminated and we don't want to contaminate anything else. All right, so now with my swabs, I'm going to take the swab and I am going to clean my patient. going to take the first swab. I'm going to go down the side furthest away from me. So I'm going to take it, run it down. All right. I'm not really doing it. And I'm going to take it around my sterile field and get rid of it. All right. Because I don't want to cross over my sterile field with a dirty swab. I take the next swab. I clean down the side closest to me. Bring it around. Get rid of it. And then the final swab down the middle. Take it around the sterile field and get rid of it. Okay. Now I've got my patient cleaned and ready to go. So I've already got my catheter tip lubricated. With a female, you can just do like 2 or 3 inches of the tip of the catheter. And with a male, it says you're going to lubricate 7 inches, but you're actually going to insert the catheter all the way up to the bifurcation in a male. I'll show you that in just a second. Okay, so I am ready to do my catheter. I'm going to find the urinary meatus, and I'm going to begin to insert. All right. Now, when you are inserting, make sure that these fingers right here do not touch the patient, because if they do, you have contaminated your sterile gloves. So now what you're going to do is you insert it. You're going to begin to look at this clear tubing and wait for urine to flow into the clear tubing. And then at that point, advance it another inch or 2. All right. Stop. You can now hold this tubing with your 2 fingers here. Come down with the syringe right here, and you will blow up that balloon. And I'll have to take it back out so you can see it. So what you do is that balloon will blow up, and the catheter won't come back out. So let me show you what the balloon actually looks like, because I forgot to do that. Okay, so what I'm talking about is once this is inserted into the person, all right, this balloon will blow up. All right, and that's what keeps it. That's what keeps the catheter in place. This will be inside of the bladder, and it can't pull back out. All right. Alrighty, so let's take the fluid back out of here. If you are inserting this into a man, you would lubricate it up about 7 inches, but it is inserted all the way to the bifurcation, and this is the bifurcation, or the Y. So with a man, it's inserted all the way to there. Now it doesn't stay all the way in. Some of it will slide back out, but at that point, you know, that's what you would do for a man. All right, so once you've got this inserted, so let me insert it again, just because we stopped in the middle so I could show you the ballooning. All right, we've got it inserted. I hold it here. I blow up the balloon, I hope. Okay, I let it go. My sterile piece is all over with. I can take this syringe off, get rid of it, make sure that it's in place. We're not going to tug on it too much. We're going to clean our patient up. We're going to attach the bag to an immovable part of the bed, not the bed rail, because then this thing will go up and down. We want the bag below the level of the bladder. We want to make sure everything is flowing freely. And then we are also going to secure this in some way or the other. And different facilities have different things, but we're going to secure this to the leg so this thing cannot pull while the person has it in it. And, you know, some confused patients will pull this completely out. After you're all finished, you're going to document. The types of things that you're going to document with a urinary catheter is that the urine is clear, or maybe it's orange, maybe it's bloody, but you want to take note of the color of the urine. How well did the patient tolerate the procedure? If it was very painful, maybe there's some other issue or problem going on. How much of the sterile fluid that was in this syringe did you insert into the balloon? What was the size of the catheter? In this case, it's a 16 French. 14 French would be a little bit smaller. Sometimes they'll use a 14 French on a male. With a female, they might go with the 16 French. And you know, that's a nursing judgment that eventually you'll learn. Right now, don't worry about it. Whatever is in the kit is what we will use. So, and that's a female. With a male, the only difference is it's not very hard to find the opening, which is nice. But with a male, the cleaning, let me go find a male part. Hold on, just 1 minute. All right, there isn't one handy, but I can show you like this. If this is the penis, okay, the cleaning is going to take place from the tip, and you're going to move down like this. All right, don't go back up. Once you've cleaned it, you're going to start with your other swab and move downwards. Again, start from the tip of the penis and you move downwards. It says to the base of the penis. That's true. Sometimes, I mean, your hand is going to be there too. So, you know, don't get hung up on, I'm not quite to the base. All right. And then again, you'll just hold the penis in place and then take your catheter and insert it. Again, you're going to insert it all the way to that bifurcation, which is way up, here. Okay. And I think that's about it. I hope that this helps. I know you've got an ATI video. That will help as well. You'll notice that there are some differences. That's okay. Your gold standard is going to be your checkoff sheet. So make sure you use that for checkoff purposes. And then the biggest thing is practice, practice, practice. So even though you may not have a model at home, you certainly can, you know, talk through those steps. If you're really creative, maybe you can make something that you can use to simulate putting in the catheter. So, you know, do let your creative juices flow. And once you get back to school, then we can get you into the lab and you can actually practice on some of these models. Hope this helps, guys, and I hope you're feeling better. I hope you're COVID negative and all that stuff. Good evening.